Good evening, everyone. This is Adafshin on behalf of IGCP. I warmly welcome to all our respected doctors and participants for today's digital live session. Today's topic is atopic dermatitis to asthma, connecting the dots. Highlights the concept of the atopic march, a progressive pathway that often begins in early childhood and can evolve into chronic respiratory disease. Understanding the immunological links, early risk factors, and preventive strategies is essential for improving long term outcomes in pediatric patients. This session aims to help clinicians recognize early warning signs and intervene effectively to alter disease progression. It is my privilege to introduce our esteemed speaker for this evening, Dr. Vijay Varat sir. He did MBBS, MD. He is consultant, allergist, pediatric pulmonologist, and clinical immunologist. He is consultant at Sai Allergy Asthma Eye Hospital, Sai Sahyadri Hospital, Imandar Multi-Speciality Hospital in Pune Allergy Center. Dr. Varat sir is a well-known expert in pediatric allergy, asthma, and immunology. His vast clinical experience and patient-centered approach make him the ideal speaker to guide us through this interconnected topic. With great pleasure, I now hand over the session to Dr. Vijay Varat sir to take us through this insightful and clinically relevant discussion. So, this is over to you. You can proceed with the next, sir. Thank you.
Thanks for the introduction. Thanks to IGCP for giving me the platform to share my experience. I will say last 35 years because I still remember in 1990s when one of my best friend he had a very severe anaphylaxis and he was not diagnosed for a years together. What was the reason? And so luckily one of the European team had been in Mumbai or hospital and I attended the lecture and then I understood that the allergy is the most neglected in India and still I remember from where I have been my MBBS MBA. Still in those colleges also, medical colleges, there are no allergy departments. So last 1990, I'm still finding that even the service providers are not serious about the allergy. Even dermatitis, atopic dermatitis, eczema, which is just symptomatically treated, tonsil adenoids, throat infections. You will see in the next few minutes how they are related to the allergy. From there to childhood asthma, where the 90% of the children have adult underlying allergy, and even adults with severe allergy or asthma always have the beginning in the childhood. Like recently, 4 months back, when I spoke to one of the national conference of chest physicians on how the allergy is a very integral part of pulmonology in adults also. So many of the chest physicians came to my center at Pune for a training on allergy. So we know like pollution is a big problem now everywhere. The talk is happening on that since so many years. We are speaking on that. And recently, even the local elections, a lot of the corporators which are interested into that, they also spoke on pollution. I am so happy with that. So if you see the growing increase into these conditions has increased. Recently, this year, we published two articles, one on adult allergic rhinitis, how the even simple questionnaire is into the OPD basis. We picked up that around 40,000 patients had been analyzed in India. 50% the allergic rhinitis is into the OPDs, and it's not a lower immunity, it is a hypersensitive disease. Even there are a lot of genetic and environmental factors, and even a lot of patients are misdiagnosed. Even the simple spirometry is not done into the lungs, and we should remember that. So people talk, "Ki, why now only I'm having an allergy?" So initially the sensitization happens, then it reaches to that level, that threshold, and then the irritants or the triggers, they just trigger the allergy. So it's a very big cascade. Early phase, most of the patients they have a response to the antihistaminic and all, and they don't bother about that, or some of them go to the Ayurvedic homeopathic, they are controlled with that. Later on, they have established multiple sensitivities, and the inflammation is at a very severe level. They don't respond the same efficacy what previously they used to respond. So that's why people take it very casually. So the indoor and outdoor pollution has already increased. Now it has been considered as a epidemic, and the sensitization initially starts from the skin of the baby, then the Th2 as well as interleukins they reach to the different parts of the body, and the patient presents with the so even the neonatal allergy is there. It has been already documented. We are underdiagnosing. We are missing these cases. If we keep the eyes open and the mind to know about the sensitivity pattern has changed, the genetics has changed, and we have to identify these patients in an early stage. So a lot of children with the infantile colics or food intolerance, out of that, many of them are going into rhinitis, rhinosinusitis, conjunctivitis, asthma, or deviated nasal septum and all. So there are so many risk factors. Even the maternal, the gynecologists have a big role. They have a hidden signs of allergy into the adults. If they are picked up and they are investigated, the children will not have a severe. So the Th2 cytokine imbalance or the gut inflammation causing a dysbiosis, they will have a different type of polarization. And then the repeated exposure to the pollutants and allergens will trigger the things. So from skin as a eczema to stomach problems to indigestion, constipation, these patients land up to the adult allergic march. And even there are allergy prevention program. Myself and Dr. Vishali were lucky into that to be associated with 4 years for how to prevent these severe food allergies, atopic dermatitis. So connecting the dots means what basically? That we should identify these hidden signs like this child had a significant rhinoconjunctivitis when he had been to us with an early cataract also because of the repeated eye steroids. So in between he was fine, but his symptoms may be controlled, but his hidden signs. So which are those? Like a dark circles, then turbinate hypertrophy, then eczema, or even the long eyelashes, the wrinkling under the eyes, bad breath, excessive salivation, white coating of tongue, upper caries of teeth, cervical lymphadenopathy. So these can be the hidden signs, the dryness of the skin. It's a big problem. 70% of the patients with rhinitis asthma, we have found that they have a significant dryness of the skin or itch, and it is very uncontrollable. So whenever they itch the eyes, nose, ears, or skin, that can be the early signs, and the quality of life is suffered a lot. It is worse than the asthma, diabetes, and epilepsy. So even because of the first generation antihistaminics, they are so overused in India. So the quality of sleep is affected in daytime, and then because of the junk food and cesarean deliveries, from there to the massages of basins and the milk to the skin to the gut inflammation causing the imbalance of this Th2 to Th1 and triggering the symptoms. So the chronic phase, once the patient is in a like maybe whichever part of the body. Here the skin we have given an example, but even the rhinosinusitis, blocked nose, deviated nasal septum, sinusitis, snoring, then food allergy is now increasing 5 to 7 times the admissions have increased. So the people talk about just intolerance rather than the food allergy. But food allergy is very severe, like anaphylaxis like symptoms, choking, severe itching, edema, then even the dysbiosis, which will lead to the other autoimmune overlap also, and then the hair problems or the stomach problems, and then the rhinosinusitis, conjunctivitis, asthma, chronic respiratory diseases. So if you see the culprits are very common, but they are invisible. So if you see from something is coming into the sunlight, you can see something floating into that. So these are invisible. So like dust mites, they are corrodes in the bed.
Since
Daily
most
1.5 gram of
matter
mouse can be exhaled. Human dander. And 1 gram, more than 10 lakh dust mites can survive. Like pollens. The pollen calendar should be analyzed. There are botanists, zoologists, aerobologists. So people worry about the cancer, but the chronic respiratory disease, which is increasing day by day, which has a relation from asthma COPD to comorbid conditions, even eosinophilic esophagitis, to obstruction causing a learning disabilities to daytime dizziness. So if you see this, for example, I will give some examples like eczema. This child had been in a very severe stage after asthma and all. This upper caries teeth, turbinate, conjunctivitis, angioedema, anaphylaxis, this oral ulcers, to conjunctivitis, then this buses and all is a very regular thing. But if you see the turbinates, such an enlarged one in many of the patients, like tonsillar adenoid, Th2 inflammation, like fixed drug eruption to severe drug allergies. then urticaria, then angioedema, then this same child, the infected eczema came. So these, like as I mentioned, hidden signs, long eyelashes, watering of eyes, open mouth, facial grimaces, like a lot of people, derriere line, there is a horizontal notch or dark line. This like मुंह टेढ़ा करना बोलते हैं. So like a hypertrophic turbinates, and then posterior pharyngeal hyperplasia. A lot of people go on this way. So these should be picked up early, and this leads to inflammation in the upper airway, having a secondary infections. So bacterial viruses and all that trigger it. So one mucosa, one disease, leading to the different involvement from ears to sinuses, and then different is Ig production to eosinophil and then hypersecretion, and then affecting the sleep, to speech, to growth, and so many things. So the genetic predisposition to microbial dysbiosis and causing the tonsilloadenoid things, and then the barrier dysfunction and eosinophilic inflammation in many of the patients. So that's why now the targeted therapies for this eosinophilic inflammation have been developed. And so chronic rhinosinusitis, so many surgeries happen, but it does not have a benefit for a long term. Now, in the future, even the TH2 cytokines, interleukins, and nasal secretion rhinoscopy can be the future in managing this. So, consider that how we connect the dots from atopic dermatitis to asthma. So, always try to remember that. Look at the hidden signs, identify, take a detailed history in the family or any exposure to the different type of allergens, additives, preservatives. Then this genetic predisposition to adult asthmas and cardiovascular complications. So this child, which was required intraocular steroids, but without that, when we give omalizumab, like targeted therapies, the reversal of the inflammation, the papillae reduced to the normal one. Even 14 years old, growth retardation, barrel shaped change, HRCD4, cystic fibrosis, bronchoscopy was done. Then this was 12 years, protruded. He was given a nebulization and all. But why it was a upper airway cough syndrome, post-nasal dribbling. So simple things we can manage. Like this patient had dust mite, milk sensitivity, and we control that. Otherwise, 4 times he was admitted with a severe bronchitis. So if you connect these proper history and testing, safe medications, we can prevent such type of severe hypoxia leading to ICU, then such affecting the cornea, and so many overuse antihistamines and oral and parenteral steroids affecting day to day. So the safer second generation antihistamine should be used than the first generation. And then the third generation also are helpful in the chronic cases. Then the two-way blockage, like dual action on the inflammation, how it can control the further progress of the disease. So prevalence has increased only, the sensitization is also increasing, and connecting the dots means basically the in between whatever this sensitivity which is continued, and it will affect the newer sensitivities and the further progression. We should stop that. So that's so this minimum persistent inflammation should be managed properly so that the further complications can be prevented. And we have to identify these specific allergens like dust mites, pollens, cockroaches, animal dander. They are universal. They can travel around 15, 16 kilometers. They can travel around pollens hundreds of kilometers. Dust mites, beds, sofa, curtains, and all. So even there are how we can prevent these severe complications. So primary, secondary, tertiary preventions. Then then you can see like how the early age wheat and uh, early introduction of the foods can help these complications, and then barrier repair like a lot of moisturizations, some scientific and research based medications, and immunotherapy is the very well which can be really useful to the patients. So if you see like probiotics now and biologics are the futures. So microbiome, they are altering the things. The gut lung, gut brain, gut skin axis can be repaired with the proper probiotics, and the TH2 to TH1 imbalance. Then even the exposure to the cow dung or early age palm dusting, and long term wise even the asthma, the desensitization or immunotherapy, which has been recommended by the international guidelines also. So the allergy testing, which one to do, specific immunotherapy. So people just go for the any labs and all, they are not useful. The specific IG for the specific these conditions of different allergies can be identifying so that it can reduce the medications and the further inflammatory cascade. So 85% of the patients they show the skin test positivity. Even the Indian College of Allergy and Ophthalmology guidelines have suggested that skin standardized testing with the penless, bloodless lancet you can see over here. How than the specific IgE testing only for food allergies whenever it is indicated because the mast cell bound IgE is picked up and you can see like how it has beneficial. Even the newborn baby also we can do the test now. It is very safe and you can see the specificity and sensitivity in standardized skin test. So now the component is all diagnosis in the future now in a specific severe food allergy patients rather than the panels of tests. So latex or fire ant or some of the patients which have a cross reactivity. So commonest dust mites, pollens, molds, 2 to 5% foods, and then biomarkers, specifically cytokine profiles, can be done. Then the avoidance measures for the specific patients, depending on that, like dust mites, reduce the indoor dampness, humidity, use the proper bed covering, like pollens, use the mask while going to the schools, offices. Pets and all should be kept away at the balcony or somewhere. Vacuum cleaning can be done. Then mold, the 5% liquid ammonia can be used to be reduce the sensitivity, and then the immunotherapy. So basically, the smaller quantity of allergen extracts in a purified form, in 1000 to 500 to 200 concentration built up phase, and then the maintenance phase. So if you can see, this is a very important part in preventing this and connecting these dots. So Th2 to Th1 in balancing. So blocking the antibodies and forming the IgG1, IgA4 or mucosal IgA balancing. So again, the severe asthma patients or severe allergies, these targeted anti-interleukins treatment like biologics, omalizumab, mepolizumab, benralizumab, dupilumab can be. So these are the cases where we can do the testing and immunotherapy, and how we can reduce the allergic pathway to Th1 imbalance. So long-term wise, what we can expect with the disease-modifying therapy, and it will be really beneficial to the long-term wise. So these are the specific cases where we can have the proper allergy management, I will say, rather than just symptomatic management. We are all symptomatically managing. So we can reverse from Th2 to Th1, and besides the medications or biologics, even the World Health Organization since 1998 has stayed back. The disease-modifying therapy can be so identifying the biomarker test, even the cytokine analysis can also be done, and these different type of biologics can be really useful. So symptom-wise, we are treating from dermatitis, rhinitis, sinusitis, ocular allergy, urticaria, eczema, even divided nasal septum, sinus surgeries. But long-term wise, depending on the current scenario, rising temperatures, climate change, and pollen sensitivity which is increasing, we can help the patients with a better management. We can connect these dots. I will say can do the proper allergy test, desensitization and specific precautions, and disease modifying desensitization, probiotics, biologics therapies. That way, it will definitely help our patients, and how these severe cases also can be reduced, and the complications will be improved a lot into these patients. So that awareness should be brought into the community, and it will be really useful to the people. And as I mentioned, since last 35 years, I'm seeing the things, and still in India, even the service providers are not serious. So most of the people they just go to alternative therapies. Even so many advertises are done, so many breathing technology and all, and they say, "Ki we will cure the allergies." It is not that way. It is a lower, it is a hypersensitivity. It is not a lower immunity, and specific research-based, evidence-based treatments will alter the progress of the disease, and it will definitely help the community to stop this march, and not only, and we'll connect these dots and will prevent the complications, and not only the patients, when the next generation also, because I see a lot of children coming with severe adenotonsilite, even snoring, then severe eczema, severe asthma, affecting their quality of life in the growth, behavioral disturbances. It is all because of the carbon dioxide retention and all. So even we have to manage it properly so that we can prevent the complications. Thank you. Thanks a lot.
Okay. Thank you so much, sir, for this and such information, sir. With all your permission, sir, shall I take question one by one?
Please.
Okay, sure. Uh, so the first question we received is what immunological mechanism link atopic dermatitis in infancy to the later development of asthma?
Basically, as I shown in my slides also, the sensitivity happens from the skin, and then the Ig interleukins, they go to the different parts and they cause the inflammation, and then the symptoms come from the other parts of the body. So that is called a Th2 inflammation. So this Th2 inflammation continues, and then it comes out from some or the other body parts. That's called allergic march. So that is the basic immunological mechanism. So by proper management, the Th2 to Th1 balance happens. Then this allergic march also can be stopped.
Okay, thank you so much for this brief answer, sir. So the next question is which early life factor increase the risk of progression along the atopic march?
Actually, so as I mentioned, it's a genetic disease, and hereditary part is important. And then second is the hygiene theory. So those people with a cesarean born delivery, then the early infancy, if they are given antibiotics or the painkillers, and if they are not exposed to the natural cow dung or palm dust and all, this will aggravate the allergic march.
Okay, thank you so much, sir, for the question for this answer. So the next question is: can early intervention in atopic dermatitis after the long term of risk in asthma development?
Yes, actually,
Okay,
as it will persist, and if it is an early age atopic dermatitis, there are more chances of developing asthma and all. So, if you interfere early and if you manage atopic dermatitis properly, then the severity of the asthma and the delayed presentation will be there.
okay. Thank you so much for the answer, sir. So the last question we received is how should pediatrician counsel parents regarding prevention and early detection of allergic airway disease?
Yes, actually, a very important question. Actually,
Mm,
even gynecologists also and pediatricians both have a very big role into that. So the hidden signs, as I shown, those should be
mm.
picked up by the even the parents by the gynecologist, and the pediatrician should pick up in the child, and the detailed history, family history of first degree relative having any of the allergic symptoms, from seborrheic dermatitis to asthma to snoring to gut inflammation to skin problems, should be taken in consideration. And then the children should be followed accordingly, so that if they are developing any symptoms early, and if you identify the allergens properly, it will help like a diabetes. We identify in an early stage and we can prevent the complications. The same way here also, the pediatrician have a very important role, so that these airway symptoms are controlled much better, and the nasal hygiene also can be mentioned. The nasal steroids can be given in an early stage, and depending on the seasonal exacerbations, some safe medications, so they will control the inflammation much better.
Okay. Thank you so much, sir. I hope you did justice with all the answers, sir. And once again, I thank you for Dr. Vijay Virat, sir, for such a clear and insightful and clinically enriching session, sir. Your explanation of the connection between skin and airway disease has truly helped us to understand the atopic march in a practical manner, sir. On behalf of IGCP, sir, I extend my heartfelt thanks to all the doctors and participants who joined us today, sir. With this, sir, shall I conclude the session, sir?
Yeah. Thank you. Thanks a lot.
Okay, sir. Wish you all a healthy and pleasant evening ahead, sir. Thank you and take care.